Well, hello there. Can I just start by saying the goal of my channel is to bring information, and different models to help understand each other, and build healthier relationships, of course. Today is an important and even complex topic, actually. I'm not going to go, too deep into it. It's sort of like a brief overview. You don't have to know someone specifically with any diagnosis, to want to learn, relate, or even gain awareness. If you recognize, though, some of the traits, I'm certainly not a licensed psychologist, or clinical psychologist. However, I do have a science degree in child development and an arts degree in behavioral science. So I'm just sharing with you what I have learned over the years, both professionally and personally. So I don't hold judgment and ask you could do the same. So with this particular topic, Antisocial Personality Disorder actually has two acronyms, depending on where you get your information from. Over the years, I found out ASPD and APD. But it's a personality disorder characterized by a limited capacity for empathy and a long term of disregard, the violation of rights of others. Other notable symptoms include impulsivity and reckless behavior, a lack of remorse after hurting others, deceitfulness, irresponsibility, aggressive, behaviors. Symptoms of APD must present usually by the age of 15 to receive a diagnosis. But antisocial behaviors often have their first symptoms at, I would say, age 11. The prevalence of APD peaks in people that are like 24 to 44, and then I know that it decreases between the ages of like 45 and 64. So, it's more common with males than females in the United States. The rate of it is about, I want to say 1 to 4%. I might want to argue that one day. I think there's more. But personality disorders are a class of mental disorders, characterized by enduring an inflexible, maladaptive pattern, basically, on behavior, cognition and inner experience, exhibited across many contexts and deviated from, those accepted by any culture, really. These patterns develop in early adulthood and are associated with significant distress or impairment. Criteria for diagnosing personality disorders are listed, in the ICD and the DCM. But, sometimes, can be confused actually with asocial. While the first is characterized after their disregard for the people, the latter is more characterized by like a lack of interest in social activities, due to their tendencies toward recklessness, Patients with APD are at a higher risk of drug and alcohol abuse. APD is the most likely to be associated with other addictions, though, too, They're higher risk of even illegal drug use, shorter periods of abstinence, misuse of paraphernalia, gamblers, and other addictions that basically lead to other illegal activities. And the APD has been associated with like a higher level of, that impulse control and suicidality. And that's a little different because it's more of like the acts for attention seeking. And they have irresponsible behavior, usually resulting in heightened levels of aggressive behavior, domestic violence, pervasive anger, violent crimes. These behaviors usually have negative effects on their education, their relationships, their jobs. Alongside this, there's risky sexual behaviors. They're seeing prostitutes. They're not having protected sex. They're trading sex for drugs. Their impulsive behavior will usually jeopardize their own safety and the safety of others. People with APD tend to describe emotions with like an ambivalence and like a they experience heightened states of like an emotional coldness and detachment. Individuals may often experience even chronic boredom, emotions like happiness and fearless, clearly more often than others. They have difficulty mentalizing or understanding, the mental state of others. They may also display, perfectly intact theory of mind, or the ability to attribute a mental state to oneself and others, but definitely an impaired ability to understand how an individual may be affected, by their aggressive action. These factors might contribute to aggressive and criminal behavior, as well as empathy defects. Despite this, they may be adept at social cognition, or the ability to process, and store information about others, but that's because it contributes to their increased ability to manipulate others. APD is highly prevalent among prisoner populations, actually. People with APD tend to experience more convictions, spend more time in jail, and are more likely to be charged with almost, any crime. But far more assault, violent crimes. It's most common, like arson, even destruction of property. They begin conduct disorders in their youth. They have a pervasive pattern, or at least very defiant behaviors. They are more interested in benefiting themselves, regardless of the expense they have on others. They may have no regard for morals, social norms, or even the rights of others. They have difficulty sustaining or entering relationships often, but they revolve interpersonal relationships, I would say, with someone around the exploitation and abuse of others. They may display arrogance, think lowly and negatively of others, have limited remorse for even their harmful actions, and have even also a callous attitude, I've seen, toward those that they have even harmed. They frequently deceive, and manipulate, people, even when, in harmful ways, because it's to gain pleasure, they're after something. Some have, or most, I would even say, superficial charm, I don't know what's going on with planes, but others do this, but they do it for intimidation and violence. So individuals with a diagnosis may deliberately show, irresponsibility, because they tend to place blame on others when they have difficulty internalizing, or acknowledging their faults, and instead show an outward expression that redirects the attention, of their mistreatment onto something or someone else. Many studies even suggest, I know back in the day, that the social and home environment does contribute, to the development of APD. The parents of the children, usually display antisocial behaviors, so then, their children adopt those behaviors. A lack of parental stimulation, during early development can lead to higher levels, of cortisol, with the absence of balancing hormones, like oxytocin. This disrupts and overloads the child's stress response, systems, which is thought to lead, to underdevelopment of the part of the child's brain that deals with emotions, at least, and empathy, and ability to connect, with other humans. On an emotional level, at least. Parenting styles can directly affect, how children experience and develop in their youth, and can have an impact, on a child's diagnosis. Having a healthy, safe, stable, abstinent, or consistent, understanding, attentive parenting, style in an environment, as well as the community, right? To help ensure more positive behaviors. for children, it's an overall decrease in symptoms, at least if, they end up having it. It's also highly comorbid, though, with, like, I'm thinking, like, emotional and physical abuse. We're talking more like physical neglect also has a significant correlation. The way a child bonds with its parent early in life, is important, as we know. But poor parental bonding due to abuse or neglect actually puts the child in a greater risk for developing APD, it turns out. So studies have shown that, non-abusive individuals are less likely to develop it. And those with APD may have experienced any of the following forms of trauma. I had scrolled down because I was thinking back, physical, sexual abuse, neglect, coercion, abandonment or separation from a caregiver, violence in the community. They may be bullied or acts of terror, life-threatening incidents. Some symptoms can mimic other forms of mental, illness, such as like PTSD, reactive attachment disorder, and then there's disinhibited disorder, disengagement. I would add even dissociative and identity disorder too. APD is considered to be among the most difficult personality disorder to treat. Rendering an effective treatment for APD is further complicated due to the inability to look at comparative studies. We got psychotherapy, and then we have the diagnostic criteria, but it's a focus, on treating incarcerated patients rather than those in the community, because, these guys don't have remorse. They're not looking to become better people. They don't want to commit to change. They can be seductively charming and dishonest, and may manipulate staff and fellow peers, or patients during treatment even. Studies have shown that outpatient therapy isn't likely to be successful, but the extent, with a person, it's entirely is responsive, to the treatment, maybe exaggerated, but most treatment is done for those in the criminal justice system, where the treatment requires, are given because of their imprisonment, right? Those with APD may stay in treatment only as required, like by an external source, but that would be like a person like on parole, with those conditions. But residential programs that provide carefully, at least a controlled environment of structure and supervision, along with peer, I would say, confrontation is important. Support is recommended. There has been some research on the treatment of APD that indicates like positive results for therapeutic interventions. Psychotherapy, also like talk therapy that I've mentioned before. Psychotherapy, lost my train of thought. Sorry. The biggest thing is it's not even just the person needs to take accountability and get active in treatment, but complete cooperation and participation of the family members too is important. Some studies have found that the presence of APD does significantly interfere with treatment if a person has a substance abuse problem too. Therapists working with these individuals also struggle because they have considerable negative feelings, of course, towards these patients who have these extensive history of like aggressive, exploitive, abusive behaviors. And, these people supposed to be entering treatment attempt there's there to support them to develop a conscience in these individuals, which is extremely difficult considering the nature of the disorder. Therapeutic techniques are focused on, rational and utilitarian, actually, arguments against like repeating past mistakes, basically. The approaches would focus the tangible material value, of pro-social behavior, and abstaining from the antisocial, pattern. However, the impulsive and aggressive nature of those with this disorder may limit, the effectiveness of their therapy. I want to simply close by saying, respectfully, of course, don't hold others hostage because you feel unstable. Common misconception is the whole, victim of circumstance. Many people, go there. However, it doesn't give you the authority to do bad things, let alone hurt others. It's imperative to always hold yourself accountable, first and foremost. Don't play the blame card. It's my mother, my father, my daughter, my spouse's fault. I'm in this position. They didn't put you where you are in your decision making. You did. Antisocial personality disorder types, they get stuck between like this ego and the mental illness, and then they mix it with like a disregard and substances. You probably have heard of the expression, not every sociopath is a serial killer, but every serial killer is a sociopath, untreated. I feel like self-control and accountability go hand in hand. Remember, there are 3 things that you always can control, and that's your efforts, your attitude, and your discipline. It's about making the decision to do just that. We are all human. But if you choose the latter, then expect consequences, okay? All right, guys. Thanks for listening. Talk to you guys later, okay? Bye.